Good morning, or good afternoon, or good evening. What is trauma release? So trauma release is a specialist type of counselling intervention that helps people process traumas that are trapped in their subcortical part of the brain. I'm going to try and simplify this. First thing I will say is the examples of trauma release: Emdr, eye movement desensitization, reprocessing, Brainspotting, somatic experiencing, which is sometimes called SE, and some somatic therapies. So I'm just going to take you back to maybe when you had a trauma to help you understand what could have happened in the brain, why you may have flashbacks, nightmares, hypervigilance, why you may have PTSD, why you may have anxiety. So how does the brain function? So when we are in a traumatic life-death situation normally, let's imagine that you see someone hit by a car. I know it sounds terrible, but let's imagine it. So in that moment, the first thing you're going to do is act. You're going to run, you're going to either call the ambulance, you're going to try and help that person, you're going to see if someone's helping them. So as horrific as that is, you're not going to stand there and scream. You're not going to stand there and start processing that trauma in that moment. Instead, your brain will go straight to prefrontal cortex and start doing, okay? So that trauma is still inside your brain. It's still unprocessed, okay? This can go on for weeks, months, or years. So what happens is the hippocampus in the brain, its job is to file our memories. But unfortunately, when we have a trauma, the cortisol floods the hippocampus. So think about a car being flooded with petrol, and because it's flooded, it doesn't actually file those trauma memories in the past. So in your brain, which is of course affecting your nervous system through the vagus nerve, it thinks that this is still current, that this still could happen again, that you could see something scary, that you could see someone potentially die. So it's keeping you on alert. Now, talk therapy, what it does is it just gets you thinking and talking back into your prefrontal cortex, which is just around here. So talk therapy is good for a lot of things, but for trauma, it's not good, because what it does is it re-traumatizes you. You need to get into the subcortical part of the brain, and to do that, you need a specialist therapy. So unless it's somatic experiencing, some somatic therapies, Emdr or Brainspotting, you may be wasting your money and making yourself worse. I've seen clients who've gone to other therapists become worse because they are bringing their trauma constantly to their prefrontal cortex, talking about it, and making their nervous system worse. So I'll explain in another video how it actually works, but I could give it a little bit of a go now. So basically, when you are focused on that trauma in the subcortical part of the brain, you're actually opening it up. It's like it's happening right now. The intensity is quite high in your nervous system. You may feel sick, you may feel overwhelmed, but then you are processing it. So it can be put in the past. I won't talk about how exactly, because there's different techniques to do this, but trauma release is a very important part of PLP, which is the Passionate Life Program, which is the program that I created. It's my third book, but I turned it into a program instead of a book, and it's running with our company PLP Solutions in job agencies in 4 states, I believe, or 3, just about to go to 4 states in Australia. I think it's really important that when you do see a therapist, you have a lot of simple psycho-ed, and that's what we do. We educate our clients. You certainly have trauma release, and you also learn how to work with this subconscious and transform your maladaptive programs. So that's what we do as well. But getting back to the trauma release, you may have a one-off trauma that's affected you for years. You can just Google Brainspotting specialists, Emdr practitioners, somatic experiencing, SE, or some somatic therapy. But it's really important that you process that trauma. And when you do, it becomes the past in your brain, It stops triggering through the vagus nerve, through the subconscious, through the autonomic nervous system. It stops putting you into fight and flight, and you can have a calmer experience. People say quite often, I would have done hundreds by now. People say that when they have a trauma therapy, it feels like that trauma's just gone so small in their brain. It's so insignificant. It is amazing. So trauma therapy works. There's not enough out there about it. I've cured heaps of people with PTSD, some who've been to war, which is pretty full on, some who've been raped, held up by gunpoint, seen people die, had people die in their arms, so many things, and I've helped them process their traumas so they can live in the now. Have a wonderful day. Make it amazing.